All right, let's now take a look at this story. Another big news coming in, concerns with regards to, the increasing number of COVID-19 cases in the Northern Cape and the Free State, and as well as the Northwest. And we are joined by Professor Alex van Den Heever on the line. Professor, a very good evening to you. Thank you so much for joining us. Well, we're getting reports that the variant first detected in India might already be in South Africa. What's your thoughts on this?
Well, it's unclear whether it is. I think there's conflicting reports, but there's been a release from the NICD that, in fact, there hasn't the case they thought would be have the Indian variant hasn't got the case doesn't come across as the Indian variant. So I don't think that it is yet in South Africa, but it is not unlikely that we will ultimately have the variant present in domestic transmission.
In as much as it might be true, but then the NICD says it cannot rule out the possibility that this variant could have been transmitted through travel. So why do we still have, our borders open with regards to those people coming from India?
I think, look, ultimately, it's not going to be possible for us to prevent the virus from entering our borders. We can't keep our borders completely closed. And this applies to many other countries. A few countries can keep such as Australia and New Zealand, can close their borders for very long periods of time as part of their prevention strategy. But it's not realistic with a protracted pandemic of this kind. What our major focus should be is preventing super spreading events from driving waves of infection. That has to be our focus going forward, and that's what causes the problem. And in India, it's not the variant necessarily that has driven their big second wave. It's been that they had completely unrestricted religious festivals that were massive super spreading events. And after a delay, you suddenly have this huge impact. And they've also had political gatherings, etc. So in the South African context, we have to watch that. We saw that when we introduced restrictions that limited super spreading, that targeted super spreading events, we immediately experienced a decline in the epidemic in December going into January. And we will probably experience that again. So the issue is not the variants. The issue is what are we doing domestically to prevent super spreading.
And it could be what we are doing here domestically to prevent the third wave, because now talks of a third wave are now growing stronger and stronger. So what should we expect from this third wave? Would it be as devastating as the second wave?
Yeah, so NICD is indicating, as I would also think, that there's the possibility that in certain areas, the third wave, if it does happen, will not be as severe as previous waves. But this is unclear in some places. So, for instance, Gauteng was clearly benefited from the timing of the restrictions in December, which means that there's still quite a large population susceptible to infection. So I think that that's really what impacts on how severe a wave will be, is how many people have not been previously infected one way or another. But the other very important factor are the restrictions themselves. So I think that the third wave will be caused by human behavior to a large extent, and it will be largely stopped by restrictions. And that will impact on the severity of the epidemic. But we have had provinces that were very, very severely affected in both the first and the second wave, such as the Eastern Cape and KwaZulu-Natal. And we might see more subdued impacts of a third wave in those areas. But Gauteng, for instance, is still very susceptible to a very large wave. So I think we have to be on our guard. We have to watch to see when a third wave is emerging relatively early, and rather target restrictions on super spreading rather than worrying about the border controls, where protocols should be in place to minimize people who are infected from coming into the country. But they are not in and of themselves super spreaders. There might be individual cases who might seed some transmission in South Africa. But what happens to that infected individual depends very much on what we do to prevent one person from infecting 50 people in one instance.
Well, medical experts have said that the current number of vaccinations are way too low to achieve a herd immunity. So where are we? I mean, from the data that has been coming through, where are we in terms of our path to achieve the herd immunity?
Well, our vaccine strategy is basically nowhere. I mean, we've vaccinated, say, 300 and something thousand people. That should be our daily target. We had about 300,000 doses of Pfizer arrive on Sunday. It's not, if they did arrive, those doses, again, are equivalent to what we should be administering in a single day with a proper full-scale vaccine strategy. So currently, we're not really advanced, and vaccines are not going to prevent the sort of continued epidemic domestically, at this rate until we get to about sort of November, December. So this is really unfortunate. The vaccine strategy, unfortunately, is not going to help us in 2021. But it has been important that frontline health workers have received the Johnson & Johnson doses and will probably be vaccinated in the next couple of months to completion. And I think that at least in terms of protecting frontline workers from any surge and in hospital cases and preventing infection there will be very important for our strategy. But unfortunately, we will probably not have many of our high-risk individuals vaccinated in time for a third wave. So we will definitely have to rely on some sort of restriction coming into play the moment we see a third wave emerging that could be problematic.
All right, Professor van Den Heever, great chatting to you. Thank you so much for your analysis on this matter.